Dr. Anthony Nino Cerrici. Welcome to the Valder Beebe Show. How are you?
I'm doing really well. Thanks for having me.
Well, they told me I could call you Dr. Nino, and I will do that. So thanks for being here to talk about lung cancer. Could you tell me, first of all, what lung cancer is, and is it the same thing as COPD? That's what my audience asked me to ask you.
Yeah, that's a great question. So lung cancer, as the name implies, is cancer that derives or grows out of the cells from the lung. And, just like other cancers, it's an unchecked growth of those cells that can grow in the lung and then unfortunately then spread to other organs. So that's lung cancer. COPD, or chronic obstructive pulmonary disease, is something quite different. That's a destructive inflammatory lesion in the lung that can lead to destruction of the airways, and that has downstream consequences like difficulty breathing and difficulty oxygenating the blood. So while both of them are diseases of the lung, they're actually quite different.
Thank you so very much for answering that question. We have so much misinformation in real society. Okay, let's talk about what is a comprehensive profiling of CGP. I don't know what that is.
Absolutely. Well, let's put this in the context of cancer, right? So lung cancer is made up of a number of subtypes of lung cancer. And in the United States, we've got about 200,000 diagnoses a year of lung cancer. Non-small cell lung cancer, which makes up about 80% of lung cancers, is a subtype that's most common and is most commonly associated with biomarker testing in clinical practice. So in non-small cell lung cancer, you have multiple biomarkers that, if positive, actually change the way a physician will test or will treat a patient, will change the drugs that they'll use. And so biomarker testing in non-small cell lung cancer really critical because it can change, again, treatment decisions. And about 65% of patients with non-small cell lung cancer have a biomarker that can change their treatment. So let me put that's the context in which we'll talk about comprehensive genomic profiling, or CGP. CGP is a way to test for genomic biomarkers in cancer. A biomarker could be a protein, it could be genetic, it could be a number of different types of molecules. But in lung cancer, we talk about genomic biomarkers, so changes in the DNA of the tumor that then are actionable or targetable by specific drugs. CGP, or comprehensive genomic profiling, is a way to analyze all of those biomarkers, all those relevant biomarkers, in one piece of tissue, one tube of blood. So you get all of the information from one test that you and your doctor need to know before you make your treatment decisions in treatment of your non-small cell lung cancer. Importantly, CGP, it's available through multiple laboratories. It's actually recommended as the workup for non-small cell lung cancer by the National Comprehensive Cancer Network, or NCCN, which makes guidelines for the treatment of these of cancer in the United States. So really, really critical in the treatment, diagnosis and treatment of lung cancer.
I want my audience to know I'm speaking with he's known as Dr. Nino. He's a senior VP at the Clinical Biomarker Laboratories and Diagnostics at Eli Lilly and Company. Dr. Nino, I want to make a comment on your answer you gave me, and I got this earlier, so I'm going to tie it in. My audience says, it's like you just answered my question. It's like you're talking Greek to most of us. And my audience is made up of engineers, scientists, teachers. They run the gamut of being educated. But your language is different than everyday language. How do we get a better understanding? Because once you sit there and tell someone that you have this condition, I think their mind goes off anyway. They're really not hearing you. They're listening, but they're not hearing you, and then you're speaking a different language. So how can we get the message across a little bit better?
Yeah, look. So first of all, I should say I'm a pathologist. I trained I'm a doctor who talks to other doctors. So while I try my best to be as colloquial as possible, sometimes it doesn't work out. So apologies for that. But I will say this is a common problem in medicine, right? There's a lot of jargon that we throw around, and oftentimes gets in the way of patients understanding what we're trying to say, particularly when you get a diagnosis like non-small cell lung cancer or cancer in general, right? You sort of, that's the word you hear, right? And so my heart goes out to patients who go through that. And personally, I've gone through that through family members who have also gotten a diagnosis of cancer. So I know what you're talking about. Even as a physician, your mind goes blank. But let me say that the bottom line in actually any cancer, but particularly non-small cell lung cancer, you want to have a discussion with your doctor about how you're going to make the treatment decisions. What are the factors that are going to go into what drug you're going to give me or my mom or my cousin to treat their cancer. And in non-small cell lung cancer, that has to include discussion of the biomarkers that are positive in that patient's tumor. It has to. Even if in that first line treatment setting where it's the first drug that patient's going to receive, there are drugs that are approved today that are specific for the biomarker, that if you have this biomarker, you can receive this targeted therapy. And that can change the course of your disease. It can decrease the number of side effects that you face. So it really is a critical piece of information that doctors need and that patients need when they're making the decision on what therapy to select. So if you're a patient or you or a loved one or a patient with non-small cell lung cancer, the bottom line, you got to talk about biomarker testing, and you got to make sure that you're getting the full comprehensive biomarker testing at diagnosis or soon after diagnosis. I hope that helps clarify and simplify.
Thank you so very much. Where do we go online to further educate ourselves?
There's a number of resources available today around testing through various patient advocacy groups, through various professional organizations. I could speak to what we're doing at Lilly right now, where we're trying to decrease barriers to testing and increase access to testing. We're a number of programs, both academic and commercial. You can learn more about that at lilly.com. You can learn more about precision medicine on that website as well.
Thank you, Dr. Nino. I really appreciate that. And thanks for talking to my audience on the Valder Beebe Show.
Appreciate the questions. Thank you.
Hi, I'm Valder Beebe, host of the Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to youtube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.